Magnesium citrate is commonly used to clean out the intestines before surgery or certain bowel procedures, such as a colonoscopy or radiography. It can also help to relieve constipation. However, it's best to use milder products like stool softeners or bulk-forming laxatives for constipation whenever possible. Magnesium citrate works as a saline laxative by increasing fluid in the small intestine, typically resulting in a bowel movement within 30 minutes to 3 hours. It's important to follow the recommended dosage and take it at the optimal timing for the best results. When using magnesium citrate, it's important to follow the directions on the product package. If you're taking it before surgery or a bowel procedure, your doctor will let you know how far in advance to take it. If you have any questions, make sure to ask your doctor or pharmacist. The dosage of magnesium citrate will depend on your medical condition, age, and how you respond to the treatment. After taking the product, make sure to drink a full glass of water unless your doctor tells you otherwise. This will help prevent serious side effects like dehydration. Using magnesium citrate too frequently can lead to an inability to have a bowel movement without using the product, so it's important to monitor for symptoms of overuse such as diarrhea, abdominal pain, decreased weight, or weakness. If you notice these symptoms, contact your doctor right away. It's also important to avoid taking tetracycline/quinolone antibiotics within 2 hours before or after using magnesium citrate, as it may decrease the effectiveness of the antibiotic. If magnesium citrate doesn't produce a bowel movement or if you think you may have a serious medical problem, it's crucial to contact your doctor promptly. Some people may experience mild abdominal discomfort, cramps, gas, or nausea when taking magnesium citrate. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication for you, they have determined that the benefits outweigh the potential side effects. Many people who use magnesium citrate do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects such as persistent diarrhea, severe or persistent stomach pain, irregular heartbeat, changes in mental/mood, muscle weakness, bloody stools, or rectal bleeding. Persistent diarrhea can lead to dehydration, so it's crucial to contact your doctor if you notice symptoms such as decreased urination, dry mouth, increased thirst, dizziness, lightheadedness, or pale/wrinkled skin. While rare, a serious allergic reaction to magnesium citrate can occur. Seek medical help right away if you experience symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking magnesium citrate, make sure to inform your doctor or pharmacist about any allergies you may have. It's important to discuss your medical history, especially if you have any bowel problems, heart disease, kidney disease, or stomach symptoms. If you have experienced a sudden change in bowel habits lasting more than 2 weeks, or if you need to use a laxative for more than 1 week, consult your doctor. It's also important to note that children younger than 2 years may be at greater risk for dehydration while using this drug. If you are pregnant or breastfeeding, it's crucial to talk to your doctor before using magnesium citrate. When taking magnesium citrate, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. To minimize the risk of interactions, it's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with magnesium citrate include digoxin, sodium polystyrene sulfonate, and tetracycline/quinolone antibiotics such as tetracycline and ciprofloxacin. Be sure to discuss any concerns with your healthcare provider. When it comes to the daily dosage of magnesium citrate, it's important to follow your doctor's recommendations. The optimal timing for taking magnesium citrate can vary based on individual needs, so it's best to consult with your doctor or pharmacist for personalized advice. If someone has taken too much magnesium citrate and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include muscle weakness, slow or irregular heartbeat, and changes in mental or mood such as confusion. Make sure to keep all your medical and lab appointments. In order to maintain regular bowel habits, it's important to drink plenty of fluids, eat foods that are high in fiber, and exercise on a regular basis. Aim for 4 to 6 8-ounce glasses of fluids daily. Magnesium citrate is commonly used to treat constipation. It works by drawing water into the intestines, which softens the stool and makes it easier to pass. This medication may also be used to clean out the intestines before a bowel examination/surgery. It is important to take magnesium citrate as directed by your doctor or pharmacist. Do not take more of it, do not take it more often, and do not take it for a longer time than recommended. When it comes to the storage of magnesium citrate, it's important to refer to the storage information on the package label. Avoid freezing and do not store it in the bathroom. Keep all medications away from children and pets. Additionally, do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed, and it's best to consult your pharmacist or local waste disposal company for proper disposal methods. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.